Bipolar disorder is a condition of the brain that causes extreme shifts in a person's mood, energy, and ability to function. It's not simply being moody or having a bad day. Instead, it's a serious illness characterized by intense emotional states that occur in distinct periods called mood episodes. These episodes are drastically different from a person's usual self. They can be manic, hypomanic, which is a less severe form of mania, or depressive. To live with this illness is to navigate a landscape of intense highs and devastating lows. It's a constant negotiation with one's own mind, a mind that can feel both brilliantly alive and unbearably heavy, often without warning or clear reason. These mood swings are far more severe than the normal ups and downs that everyone experiences from time to time. They can damage relationships, disrupt work or school performance, and make daily life feel like an insurmountable challenge. The intensity of these moods is really the defining feature of the illness. Imagine a pendulum swinging not gently but with violent force from one extreme to the other. This is the internal reality for someone with bipolar disorder. It's a biological illness, deeply rooted in the brain's chemistry and circuitry. It's not a character flaw or a sign of personal weakness. It is a medical condition that requires understanding, compassion, and consistent treatment to manage effectively. The experience of bipolar disorder is profoundly personal and can vary greatly from one individual to another. For some, the cycles between mania and depression can be rapid, shifting over days or even hours. For others, an episode might last for weeks or months before giving way to the opposite state. In between these episodes, many people with bipolar disorder can experience periods of normal mood, known as euthymia. During these times, they can live, work, and love without the disruptive influence of the illness. The challenge lies in extending these periods of stability and learning to navigate the inevitable return of the storm when it comes. Understanding this illness is the first step toward compassion, both for those who have it and for those who love them. It is a journey into a complex and often misunderstood world. The mind, which is the source of our creativity, our love, and our very sense of self, can become a treacherous place. Yet it's also a place of incredible resilience. The human spirit's capacity to endure, to seek help, and to rebuild a life in the face of such a formidable illness is a testament to its strength. Acknowledging the reality of bipolar disorder without stigma or fear opens the door to effective management and the possibility of a full and meaningful life. Mania is one of the two defining poles of bipolar disorder. It's not just a feeling of happiness or high energy. It's an expansive, elevated, and often irritable mood that is all-consuming. During a manic episode, a person might feel euphoric, full of grand ideas, and capable of anything. Sleep seems unnecessary. Thoughts race at a dizzying speed, making it hard to follow a single conversation. This state can feel intoxicating and powerful at first. Creativity may soar, and productivity can increase dramatically. However, this high is unsustainable and dangerous. Judgment becomes severely impaired, leading to impulsive and risky behaviors such as reckless spending, substance abuse, or dangerous choices. Depression, the other pole, is the devastating counterpart to mania. It's a state of profound sadness, hopelessness, and emptiness. It's far more than just feeling blue. During a depressive episode, a person may lose all interest in activities they once enjoyed. Energy vanishes, making even simple tasks like getting out of bed feel impossible. Feelings of worthlessness and guilt can become overwhelming. Concentration becomes difficult, and thoughts may turn to self-harm or suicide. This is not a state one can simply snap out of. It's a heavy, suffocating blanket that smothers all light and joy, leaving a person feeling isolated and utterly alone in their suffering. The transition between these two states can be jarring and disorienting. A person can swing from the frantic energy of mania to the crushing weight of depression, sometimes with a period of stability in between. This cycling is the core of the illness. The contrast between the two poles is stark and unforgiving. To go from feeling like you can conquer the world to feeling like you cannot even face it is a brutal psychological whiplash. These shifts are not a matter of choice. They're driven by the underlying neurobiology of the disorder. The brain's delicate chemical balance is disrupted, leading to these profound and painful extremes of human experience. It's also important to recognize hypomania, a less severe form of mania. During a hypomanic episode, a person experiences elevated mood and increased energy, but they are generally still able to function in their daily life. To an outsider, they might just seem unusually cheerful, energetic, and productive. While less destructive than full-blown mania, hypomania is still a key symptom of the disorder, particularly in bipolar II disorder. It's often the high that precedes a crash into a deep depression. Recognizing these distinct mood states is crucial for both the person experiencing them and the clinicians trying to help. Diagnosing bipolar disorder is a complex and careful process. It cannot be identified with a simple blood test or brain scan. Instead, a diagnosis relies on a thorough clinical evaluation by a qualified healthcare professional, such as a psychiatrist or psychologist. The doctor will conduct a comprehensive interview, asking detailed questions about the person's symptoms, experiences, and family history. They need to understand the full picture of the mood episodes. This includes their intensity, their duration, and the impact they have had on the person's life, relationships, and ability to function at work or school. It's a process of mapping the emotional landscape over time. A key part of the diagnostic process is gathering a detailed personal and family medical history. The doctor will ask about when the symptoms started, how often they occur, and what they feel like from the inside. They will often want to speak with close family members or partners with the patient's permission to get a more complete view of the person's behavior during mood episodes. This is because a person in the midst of mania may not have accurate insight into their own condition. The doctor will also need to rule out other medical conditions or substances that could be causing similar symptoms, such as thyroid problems, other neurological disorders, or the effects of drugs or alcohol. The criteria for diagnosis are outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. To be diagnosed with bipolar I disorder, a person must have experienced at least one full manic episode. The episode may have been preceded or followed by hypomanic or major depressive episodes. For bipolar II disorder, the diagnosis requires at least one hypomanic episode and at least one major depressive episode, but never a full manic episode. The distinction is important because it can influence the course of treatment. The doctor carefully compares the individual's reported experiences to these established clinical criteria to arrive at an accurate diagnosis. Because the symptoms of bipolar disorder can overlap with other mental health conditions, particularly major depression, misdiagnosis is common. Many people with bipolar disorder are initially diagnosed with depression because they are more likely to seek help during a depressive episode. They may not recognize their hypomanic episodes as part of an illness. This can lead to incorrect treatment, as some antidepressants can trigger mania in people with bipolar disorder. Therefore, a careful and thorough diagnostic process, which may take time, is absolutely essential for ensuring the person receives the right kind of help for their specific condition. Effective treatment for bipolar disorder is essential for managing the illness and is typically lifelong. It almost always involves a combination of medication and psychotherapy. Medications known as mood stabilizers are the cornerstone of treatment. Lithium is one of the oldest and most effective, but other options include anticonvulsant medications and atypical antipsychotics. These medications work by helping to control the mood swings, reducing the severity of both manic and depressive episodes. Finding the right medication or combination of medications can be a process of trial and error, requiring patience and close collaboration between the patient and their psychiatrist to find what works best with the fewest side effects. Alongside medication, psychotherapy or talk therapy plays a vital role in treatment. Therapies like cognitive behavioral therapy or CBT can help individuals identify and change the negative thought patterns and behaviors associated with depression. Interpersonal and social rhythm therapy, or IPSRT, focuses on stabilizing daily routines, such as sleep, diet, and exercise, as disruptions in these rhythms can trigger mood episodes. Psychoeducation is also critical, helping both the individual and their family understand the illness, recognize early warning signs of an impending episode, and develop strategies for coping. Therapy provides the tools and skills needed to navigate the challenges of the illness. Seeking help is the most important step a person can take, and seeking it early can make a significant difference. Untreated bipolar disorder can worsen over time, leading to more frequent and severe episodes. It can cause profound damage to a person's personal and professional life. Reaching out to a doctor or mental health professional is an act of strength, not weakness. It is the beginning of a journey towards stability and recovery. With the right treatment plan in place, individuals with bipolar disorder can manage their symptoms, prevent relapses, and lead productive, fulfilling lives. There is no cure, but the illness is highly treatable. Finally, the support and understanding of family, friends, and the community are invaluable. Stigma surrounding mental illness can create feelings of shame and isolation, making it harder for people to seek help. We must learn to see bipolar disorder for what it is, a medical condition, not a personal failing. Offering compassion, encouraging treatment, and providing a stable, loving environment can be profoundly healing. For those of us who live with this unquiet mind, knowing we are not alone in the storm provides a beacon of hope. It reminds us that even after the most turbulent seas, calm waters can be found again.